Hi, Trey. Thank you
Hey,
so much for agreeing to do this with me. It will be painless and brief, hopefully. So I suppose I'll jump right in. Tell me a little bit about your background and how you came into the areas that you specialize in. Like, what does that look like for you?
sure. Well, I my undergrad is in chemistry, and I've got a master's in regulatory affairs, which basically means that I can understand how to interpret FDA regulations. It's not rocket surgery, but over the course of me working for different companies, I just came up with the idea, like, look, I want to maybe be a consultant one day. And that spurred me into working for various medical device companies that have different devices in different classifications. So over the course of the probably 15 years, I've been a consultant, 6 years now, I think. I worked for class one device companies, class two device companies, and class three device companies. So I had ran the full gamut of devices. So I was able to get that experience. And then just so happened I got to be director of regulatory and quality for a wound care device company. We were doing really great. Then they decided to move the manufacturing to Germany, which they didn't need me anymore. However, I was friends with the managing director, and he's like, "Look, I can't keep paying you what I've been paying you, but we need your regulatory services, so we want to help you start your consulting company early." Because I had mentioned that to them, and he said, "We want to help you," and so that's where I got into consulting. And of course, for me and my wife, that was a big "holy cow, what do I do now?" kind of thing. But every dark cloud has a silver lining, and here I am, and it led me to the FDA group.
Well, we're glad to have you. Um, so talking about going into consulting, what are the projects that you really enjoy working on? If you could pick.
Um, Honestly, I love. I don't say I love it, but my sweet spot, I guess, is 510(k) submissions and developing strategies and developing pre-submissions and discussing with the clients, like, hey, here's what we need to do, or they have their list of claims that they want to say, and I'm like, hey, well, we may not be able to say that, but let's look and compare it to the predicate, and maybe we can work some magic and kind of get everything that you want together. As far as the type of device, I really don't have, I mean, I do have a kind of a preference. I really like orthopedics, just because I think it's really neat. I guess I should have been an engineer. I like work with my hands and stuff. So I can understand that very easily. But being a consultant, I've worked in all type of devices. So I tell my clients that I'm comfortable at being uncomfortable.
Yeah,
Knowing, and you and I've worked together for a long time, so I always say that to the clients. But it's like, hey, I may not be an expert in one particular type of device, but I am an expert in knowing how to submit a 510(k) and knowing what
right.
the FDA needs, and I know how to interpret guidances, and I know how to read standards. So, these clients that come around and say, "Hey, we want a guy that's done this, specific." That's when I'm saying, "Hey, that's great, but not everybody has that niche
Right.
where as long as you know how to navigate the 510(k) space,
Yeah.
you'll get what the client wants." So.
Yeah. No, I definitely agree because I know that some of the regulatory stuff we worked on, they're like, I want very specific. And then after a conversation with us, they're like, oh, okay. I
Yeah,
don't need that person to be like a true
yeah,
expert. They just need to understand. So,
yeah.
um, what would you say is a unique skill that you have that you think makes you that much more usable for our clients?
That's a good question. I think going back to the fact that I'm, I like to think of a jack of all trades, being able to, kind of navigate between different device types. Also, I try to put a spin, kind of like a humorous spin on regulatory affairs, because it's not. very exciting at all, and it's really kind of boring. Some people think it's a voodoo, like people that are outside of regulatory think it's a voodoo. So, I like to be able to, um, you know, just convey to the client, like, hey, you
Yeah.
know, this isn't very complicated. It's just being able to interpret what the FDA is saying,
Yeah.
because they're not going to come out and say things very straightforward, so you can like, oh, okay, I got it. But I think that's the kind of thing I like to make the clients laugh and get, feel at ease with
Yeah.
me, so they can, open up and trust me and know that
Yeah.
I'm going to do what they're, what I like to think of it as a team, like I'm
Right.
part of their team, and like, hey, I start saying we, like, hey, I'm invested in this
Yeah.
with you, because if I don't do my job, then you don't get what you want, and then that looks bad on the FDA group and on me personally. So
Yeah. No, I definitely agree. And I think that leans into kind of the next question, which I think you're probably going to answer quite similarly to how I'm thinking. And that's why do you choose to work with us, with the FDA group? So I think I can already sense your answer, but go ahead.
well, it's surely not the personalities of the people of the FDA group that I work with. No, 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 no. I think that's one of the major things that I like working with the FDA group. And to be honest with you, this has been, golly, I can't remember how long it's been. But I found Nick on LinkedIn,
Yeah.
and I reached out to him. And this is when I first started, became a consultant, and was, looking for other work. And I was like, hey, do you have any openings for consultants? And he said, sure, reach out to so and so. And so I did. And then here I am.
Yeah.
Um, and, I've worked with multiple different people from the FDA group, and you're my favorite.
Thank
Um,
you. I
you
did not
know,
pay you to say that. We have to get that in
well, we
writing
did have a
on.
conversation. So, Shelly, Katie, Tara, Mike, all those other people that I work with. I'm sorry, but Kelly twisted my arm to say that. But no, everybody, like I said, everybody that I work with the
Yeah.
FDA group, I think we have a really, really good
Yeah.
relationship. And, I consider everyone that I work with from the FDA group a friend of mine.
Yeah.
So that makes work fun to
Yeah.
me. So,
I think that's important too, right? I think you have to gel really well with the people that, we talk often and we get on calls with clients where we're sometimes not fully aware of what to expect when we're on that call. So to be able to be supportive and know that it's a good environment, I think that
yeah.
shows on our calls too. So
Yeah.
I think that's really important.
And I can't forget Sarah too. I know that we haven't worked together long, but she's in for a long, fun ride, I think.
Yeah, it has been a fun ride, definitely recently, but over the years I've been here, it's
Yeah.
definitely been a lot of fun. So, and it just keeps getting more funner as we bring more. Is funner a word? I believe it is. We're using
Well,
it.
you're from the UK, so you're a better master of the English language than I am. But,
I don't know that I'd agree. So, you know, what advice do you have for anyone that's out there looking to kind of move into this field or just, what advice would you give them to kind of help them along as they're starting out?
oh, wow. Um, I think um, one thing I think I maybe learned the hard way, maybe starting out, is you've got to be able to put up with a lot of different personalities.
Yeah.
You have to understand, like, people that are going to come and say, hey, I don't know what I'm doing, please help me.
Yeah.
Or, the other extreme of, hey, I know what I need to do, I just need you to do it. And it's like, you have to. One of my football coaches used to tell me, before we played a game, he'd always say, look, leave your personality outside the locker room.
Yeah.
So and then you go do your job, and it's like, okay, someone says something to me and it's like, not really pleasant. It's like, okay, got it, no big deal, just
Yeah.
let it kind of roll off your back. And then after the day's over, then you can go cry or jump up and down or punch a bag or whatever you need to do. But I think that's it just be able to understand that the client sometimes doesn't know what they need, and
Right.
you have to help them get there. and be able to explain it to them. So like, oh, okay, I got it.
Yeah.
So because like I said, regulatory is not, it's not hard. It's just you have to be able to interpret things.
Yeah.
But then, you interpret it and you have to be able to say, okay, well, how do I tell that to the client? So,
Right.
you know, um, just have an
Yeah.
open mind and have a lot of patience.
I think patience is a good one too.
Yeah.
Yeah. I think we all definitely have to have a lot of patience.
Yeah.
Is there anything else that you think is like important to know about you, about your history, about, the clients that we serve? Is there anything, that you think would be beneficial for us to hear about?
Um, you know, uh, Other than the things I've already said, like me being able to, pivot when need be,
Yeah.
for different device types or things like that, just know that, if I don't know something, I'm going to learn it, and then I'm going to be able to utilize that, during a project, or even before a project. And then I'm just going to try my best to get the client what they need, and be successful. Because when the client's successful, that means we're successful, and we all grow together.
Yeah. No, I think that's true. I think it's very true. I think it's why we come back to you so often with projects, we trust the work that you're going to do. We appreciate how you are with our clients, and the information that you give to them so that we can successfully work with them. So I definitely appreciate that. I know Shelly does as well, because I know you do a lot of work with Shelly.
Yeah.
I know a lot of this type of work falls on her. But you and I have worked together quite a lot too. So I'm glad that you were able to give us a little bit of your time today and just kind of talk things through. And it's always nice to hear nice things about us and what we do. So yeah, no, thank you so much for agreeing to do this. It's been great. Thank you.
It's my pleasure, and I'm looking forward to the future.